Hi, thanks for joining me for this week's movement in anatomy. We're going to talk about the pelvis and the lower limbs. We're going to palpate these bony structures that we can feel on our bodies or maybe a partner. So I'm going to start seated on a chair. And when I come to sitting down in this chair and I rock around, I can feel that bone sitting on the surface of the chair. And that's my ischial tuberosities, where there's one on either side. And if I sit in a chair like this on the back side of my sitting bones or on the posterior edge of my ischial tuberosities, it creates this rounded spine in response to gravity. Right? If we were to have a straight spine and sit on the posterior edge of the ischial tuberosities, we'd have to have some muscle engagement through our core to be able to sit up. So we come to the front anterior part of the ischial tuberosities, just slightly, so that we have this very slight anterior tilt of our pelvis. And that allows us to, without much effort, sit a little taller. We still have to have a little bit of effort, but our spine is happier. So placing the hands on the hips, what we normally call the hips, but really is the top of the pelvis. We feel this bone. That's why we can rest our hands, right? We rest here, our hands here, because we have this bone, this ledge. And if we walk our hands along this ledge, this iliac crest, and we walk it around to the anterior part of the body, we come to this bone that kind of comes down along the anterior edge of the body. And this is our anterior superior iliac spine, or the ASIS. And if we crawl the hands again along that iliac crest, posteriorly, I can turn, walk my hands along that crest. I keep walking it, and I can feel this not so bony prominent feature, but I can feel this little prominence. That is my posterior superior iliac spine, or PSIS, on either side of the spine. And then I can crawl my hands back around that iliac crest all the way to the sides, the lateral sides here. And if I crawl my hands down inferiorly, I come to that outer edge, the widest part of our hips. And I might feel, depending on how much muscle or tissue I have around my outer hips, I might be able to feel this bony protuberance. And particularly if I lift my leg and move it out towards the side, I can really feel that femur bone moving underneath my hand. And that bony part it's kind of sticking out, is the greater trochanter. And that's that femur bone moving into the hip socket. Kind of cool. All right, so I'm going to just palpate my hand in a pincher grip along my femur bone, inferiorly down, till I get towards this bony, stop towards the inferior of the femur. And there's this bony protuberance on either side, the medial side and the lateral side. And this is my medial epicondyle and my lateral epicondyle of the femur bone. And if I walk my hands a little medially and inferiorly down, I can come to this space where I have two bones and this little space on either side. And if I lift my foot off the floor, you might be able to see a little bit better. And if I extend my knee and then I flex my knee, I feel that there's this space and the two bones moving in relation to my flexion and extension, which is making up the knee joint. So I have my medial condyle and my lateral condyle of my femur bone. And then just inferior to that, I have the medial condyle of my tibia and my lateral condyle of my tibia. And that makes up my joint. So if I come back towards the kneecap, right, that sesamoid bone, that is the patella, nice hard little protuberance, bony protuberance. And then I walk my fingers inferiorly down the front of the tibia and come to this bony landmark, which is our tibial tuberosity. It usually has like a little bump you can feel. And then if I walk my hands laterally, straight from that tibial tuberosity, pretty much laterally, I can come to this bony protuberance on that lateral edge of my leg, and that's my fibula, the head of my fibula. And I'll just walk my hand back towards that tibial tuberosity. So if I walk my hands inferiorly down, I have this really nice bone. That's the tibia bone, and I can walk my hands all the way down towards the ankle. And then on that medial edge is the medial malleolus, which is part of the tibia. And if I crawl my hands laterally, I come to the lateral malleolus, which if I walk my hands up from there, this is the fibula, and I can walk it all the way back up to that head of the fibula on that lateral side. So our tibia and our fibula. And then we come down to the ankle bones, which I'm not going to talk in depth about other than the lateral, we had the top of the ankle, which is part of the tibia and the fibula. And then we have all of our little tarsal bones, much like we had our carpal bones in our wrist. We have that calcaneus bone, which is part of the heel, makes up part of the heel. And then we have the tarsals, 1 through 5 tarsals, just like we had our carpals, 1 through 5 carpals. And our phalanges, our proximal 1 through 5 phalanxes, our 2 through 5 middle phalanx, and our 1 through 5 distal phalanx, just like in our hands. So those are our bony palpations. Then we're going to take this time to do a little bit of movement, create a little bit of circulation in this lower part of our bodies, and see what you can feel as the bones move in your body. So we are going to use a chair for this, so you can just go ahead and stand up. Just standing on your 2 feet, grounding through the feet. And we're going to just hinge at the tops of the thighs. So I talked about that anterior and posterior tilt of the pelvis as part of the spine. Last week we had that anterior tilt and the posterior tilt of the pelvis. And what happens sometimes is when we want to reach for our toes, where we think, we have to reach our fingers to our toes. And so the action really comes sometimes from the shoulders as people try to reach for the toes. And the more we reach through the shoulders, the more rounded our upper back gets, the more stretch we have through our spine. And sometimes we just never get to it because we're trying to stretch through the spine, through the shoulders to get to the toes. And I have this posterior tilt. So it's really putting a lot of stress, right, also through this low back area. We really want to forward fold, bend at the knees, to push anterior, tilt the pelvis back, push those sitting bones back. So here I'm more in the exact same position that I was sitting, where my sitting bones would be pressing down into the seat, and I'm trying to find that long spine. My feet are firmly planted on the ground. But what this allows me to do is now stretch through the backs of my legs, right? Through the backside of the femur, those muscles that all attach there. And I can maybe straighten the legs, or maybe I'm too tight and I can't straighten the legs. It doesn't really matter. It's not about how far we can stretch. It's about what you're feeling when you stretch, when you bend in certain ways. So as we bend from the tops of the thighs, we draw the sitting bones back. You can even think of drawing thigh bones back and the shin bones back. All right, so we're going to take the left leg back, just into this lunge. I'm going to keep my hands on the chair to start. As I sink into this right hip, I'm trying to get this 90-degree bend in my knee, right over my heel. I'll write it right over my calcaneus. And I really want to lengthen through the back leg as well. I just want to see what I'm feeling as I stretch through. I can even put my back heel on a wall and press into a wall. Sometimes I really like that because it really elongates right through the back leg, front of the back of the leg. Front of the back leg. So we press down, and then we're going to float the hands up and draw the shoulders up over the pelvis. Inhale as you draw the arms up and over your head. Dip the back knee down towards the floor and just hover it there. Notice what it feels like to stretch through the front of the thigh, right? That front of the femur bone. And if the knee is bothering you, don't take the dip as low. All right, we're going to straighten the back leg as much as you can, and then we'll bring the hands back down, either to the chair or you can sweep them behind. This puts a little bit more pressure into that front leg that you really have to engage the glute, pull the low belly away from the thigh. Okay, then we'll reach the hands to the chair. We're going to step that right leg back. So we're into this plank, a lifted plank. I'm pushing away from the chair with my shoulders and pushing away. So if it's too much, right, just drop your knees. We are going to take a little push up here so you can bend the elbows, pull the elbows back as the biceps are going to come forward, hugging those elbows back. You're widening the collarbones, those clavicle, and then we'll push back. And then just lift the hips up towards the sky. So this is what we would call a downward facing dog, but more elevated. So it should feel a little bit easier. It's a little easier on the shoulders. There's not as much weight on the shoulders here. But you think of pulling those thigh bones back. You're bending again from the tops of the thighs, not from the back. You want to try to avoid this posterior tilt of the tailbone and think of lifting, even if you have to lift the heels and bend the knees. Totally okay. The point is I want you to feel this tailbone lifting towards the sky. All right, so this time we're going to step the left foot forward, coming into that lunge. Lengthen through the back leg. Sink into that left hip. And then we're going to lift the arms up. You can take them straight out in front first, and then reach them up towards the sky. We're going to bend and hover the back knee, noticing what you're feeling. The hips are square to the front. We almost have this action of these legs like scissors. That the heel, front heel, calcaneus bone, and the back toes are pulling in towards each other. It gets a little bit deeper of a stretch right to the front of that thigh. All right, we're going to bring the hands back down to the chair, straighten the back leg. Once again, we'll step back. You can stay with the knees lifted this time, lower down as much as you want, and then press back up. And then we'll lift the hips. Just notice what you're feeling. You're dropping that chest towards the floor, the head in between the arm bones. Remembering to, keep the tailbone high, anterior tilt of the pelvic, slight anterior tilt of the pelvic. And then we're going to step forward, coming back towards this forward fold. So you can take this forward fold as deep as you want. You can stay with your hands on the chair if that feels good to you. You can bring the hands all the way down towards the floor if that feels good to you. And then we'll rise up. And I'll just take a quick twist sitting into your chair, sitting on the edge of the chair. Sometimes I like to do this one because it's an outer hip stretch as well, taking that figure 4. So my heel's right underneath, my left heel's right underneath my knee. My right foot is flexed, right ankle of the knee. I'm just going to twist to the right. I'm going to push down into the chair with those sitting bones. Think of really pushing down and then lifting the low belly in and up. And then maybe taking the gaze around. Noticing where you're feeling, what you're feeling. Try to avoid being on the back side of the sitting bones and then twisting. Because what happens, we can't really get a twist, right? We can't, not only can we not get a twist, but the vertebrae are not in their optimal position to be moved. It's much like when you try to lift a heavy object without bending your knees, right? It puts pressure on the vertebral discs. So as much as possible, think of pressing the sitting bones in and lifting the chest as we twist. And then we'll do the other side. Find that figure 4 position, coming to the outside. And sometimes you might just want to stay here and hang out here for a while, getting to this outer hip. It feels really good to kind of stretch the outer hip when we've been sitting for a long time. And I'm going to add the twist. You could also just add the twist with the legs on the ground. I kind of wanted to do a 2-for-1 here and do both an outer hip stretch and a twist. And then you'll release it. And that's your lower body movement. I hope you were able to feel your hip, the femur bone moving to that hip socket, the flexion in your knee, an extension of your knee, and the flexion and extension of your ankles as we moved into and out of these postures. And I also threw in a little bit of upper body rotation and shoulder work just because it always feels good. So I hope you have a great day. Thanks for watching.